Going on, guys? Good morning, afternoon, evening, or night, whatever finds you on this auspicious day of delight. We are gonna be going into some health issue slash multiple sclerosis related themes. There's been a lot on my mind lately regarding that, and yeah, first off is that the medication that they prescribe is just out of hand. Like it's they you go to the doctor and you got something wrong with you. And it always starts out fairly simple, you just got like knee pain, you got numbness, you got tingling, you got weird sensations that you haven't felt before. They give you a medication. It specifically targets that exact symptom that, for the most part, it's very effective on the symptom you're complaining about. Now, go to bring this to reference about what I'm speaking about in my own life. There's a medication I was prescribed called gabapentin, and this is probably like the 12th medication that I've been prescribed for MS and MS symptoms related. And gabapentin, you read up about it, right? It's super effective at dealing with some of the very specific MS symptoms. Like I have numbness and tingling in my arm. This has been the case for the past year. It has not gone away. Probably more than that. I think it's like almost a year and a half now at this point. I've had numbness and tingling in my arm. It's like you wake up, you got pins and needles in your arm, but it just never goes away. It took me a long time to get used to it. Very long time. Basically down from my elbow to my hand. The tips, fingertips. That's where it's worse, in my hand and fingertips. But the gabapentin, super effective at treating the the numbness and tingling, which is a very difficult thing to treat, to be quite honest, because I've done a lot of things for that and nothing except vocational rehabilitation seemed to help with that, using my hand like a stress ball and squeezing it. They gave me like a putty. It's got a really perfect texture to it where it kind of melts in your hand, but it has enough firmness that you can use it like a stress ball. So that seemed to be very effective at that. But there's this medication that they prescribed to me, and it's great for 2 3 serious symptoms that I have and I'm trying to deal with. But you scroll down to the side effects, and it's mind-blowing. I mean, I'm going to read some of this to you guys. It's the most common side effects of gabapentin include extreme tiredness or fatigue, sleepiness or drowsiness, sedation or a decline in motor skills and thinking, vision problems such as blurry or double vision, anxiety, nausea and vomiting, diarrhea or constipation, dizziness, difficulty remembering things, weight gain, dry mouth, fever, peripheral edema, which is swelling in feet, ankles, legs, hands, and arms. Now, I want to tell you that right now, I experience like 90% of those symptoms already. Just think, if I'm taking a medication to deal with 1 to 3 of my symptoms, imagine what's going to happen now that I'm taking a medication and the side effects create 12. They exacerbate and make worse 12 of my already existing conditions. These are the things that you have to weigh when you're talking about taking something to help yourself. Because is that really gonna help myself? I don't think so. I don't think so. There's so many things that I can think of to help with the issues I'm having that do not involve making 12 things worse. So, you really gotta pull these things apart abstractly and just look at them piece by piece. And I can go through a whole dish of medication I have sitting in my drawer. I'm gonna pull it out. Look at this. That I've thrown away. I've thrown away. You could see 1, 2, 3, 4, 5, 6, 7. There's 7 medications in this cup, and I've thrown away probably 5 of them already. I mean, it it's just wild how the doctors, how this medical industry, like, they don't want to help you out. They want to give you something that's gonna, solve the problem for right now. It's gonna create 10 more. You're gonna have to come back. It's gonna be a continual thing. You're gonna keep getting, from one medication, you're gonna have to take three. Those three are gonna cause you to take 12 and just forget about it. You barely make it 30 years on these medications. I seen it happening with my father. My father, was retiring, and around those times, when you start to slow down, especially if you're a person that's always been going, always been moving, always been doing stuff, and you're physically active, you're mentally active, and then you slow that down, it's going to cause a drastic change in your health as well, because it's like preoccupation with things. You can think of that in a lot of terms, where you might like have some really serious emotional stuff that you're going through, but you go out to drink, you go out to party, you're preoccupied. You don't really focus on these things and give them their due. But um damn, the scatterbrain. Unfortunately, I feel like I lost that thought. But you know, it's just, oh yeah, yeah, yeah. My father was he was retiring, and he started to slow down. Didn't really have any health problems. He had a little bit of foot drop, some pain in his lower back, things like that. But once he retired, you know, I mean, it's in conjunction with, obviously, you're the oldest you are in your life when you retire, but things start to manifest more than usual for sure, because there's a lot of older people who continue to stay active in that way, and they don't really take so big of a hit, and it's not all at once anyway. It's a little more gradual. But so he decided to retire, and he ran into a lot of health issues that the doctors, if my father was not as vigilant as he was about his health and looking into these things on his own, he would he would be dead already. That is a guaranteed fact. And his father before him. And that's what woke my father up, was that they were killing his father and his mother in the hospital. They just, they're trying to treat you for existing conditions and what you're experiencing in the moment. They're not trying to create a solution to the problem. They're not trying to deal with the root of it. They're not trying to deal with what's causing it. They're just trying to deal with what you're experiencing at the moment and make you okay to send you home. That's it. They want to deal with you, prescribe something, or give you something, give you advice, or, and then just boop, send you on your way, get you out of there, bring in the next person. And, you could look at your insurance. You have the accessibility for that, and you could see that they put in all these claims. You go to the doctor for a cold, to have your friggin' throat checked or something simple. a lot of these doctors are putting through a lot of other claims. Either that, or for the simple claim of getting checked out for a cold, they want to charge an exorbitant amount of money. And now, that's not a bill that you're seeing come to your house, nothing like that. So, of course, the doctors want to charge all this money because at the end of the day, the insurance is they're looking out for the bottom for their bottom dollar. So they only pay a certain amount for these things. And unless you have a very good insurance, usually private, they're not going to pay too much to the insurance. And so that affects the medical care that people receive because especially if you're on like Medicare or sorry, Medicaid and or just one of these cheaper insurances that are for poor people, whatever it might be, lower end, they don't have as many benefits. Those doctors, they want to get you in and out because they're only making $100 off of you. And, these doctors are still, they're making 40, 80, $300 an hour, these doctors. Now, obviously, it can vary a lot, but they sit there. And I've had tons of doctors tell me, that they didn't go to medical school 7 9 years of medical school to sit there and do paperwork, but it's like, bro, not only are you charging my insurance, but you're asking me for $40 out of pocket, some of these doctors, to fill out a paper that they're still making like 40 $100 for that hour, and they're only with me for maybe 30 minutes to fill out this paper. I've even gone in the back room of a doctor's office, in another room, in like the break room, and I've filled out paperwork. It's crazy. It's just nuts. So the medical system that we've got some of the most amazing technology, and a lot of the systems that have created such an efficient healthcare system in parts. Those things are there, but at this point the system is not what you can expect it to be. You really have to hold them to account, and you have to stick up for yourself. You have to be an advocate for yourself because nobody else is going to be. All right, these doctors are going to look out for you statistically. They're going to look out for you how, all right, these symptoms match up to this, and this is the treatment for this. So it's like there's no personalized care, or there is, but you got to search for it. It's not easy to find. You're not going to run into it when you're just going through the proper routes. So you have to be very vigilant with things. Your body is a temple, and it is capable of manufacturing and doing many things that pharmaceuticals can. So you have to remember that, again, these pharmaceuticals are derived from natural substances. They're concentrated forms of natural substances. So look into what you really need, and you can find a lot of holistic things that can help you. Or you know what? At the very least, mind over matter. Look at they test things against the placebo effect. So if you just go with that plus anything else like physical therapy, just continual, stimulation of a part of your body that's troubling you, I think that there can be amazing progress that you'll see because I've experienced that myself. I do not want to fall victim to these medications that are going to inhibit me. I'm a 32-year-old adult who's looking to get married. I'm having financial problems, and there's a lot of things going on in my life. But the last thing I want is to not be physically able and to not be able to carry myself because mentally I've got a lot going on up here. And if I can't do that physically, I'm going to start to fall apart because I need to be able to execute on the things going on in my head. And, I don't have enough money to be able to, tell people what to do and do these things for me. Nor do I want to do that. I don't want to do that. I don't want to have to do that, you know? So I don't know, we got to do the best we can for ourselves and really try and stay focused, stay positive, think back. I was telling everybody today in the MS community that, a good way that I like to bring myself back, because it's weird, when you're not thinking about it, when you're not trying to exercise, when you're not trying to improve yourself, when you're just going about your everyday thing, sometimes you're gonna have those moments where your body didn't do what you wanted. But there's other times I've noticed where your body reacts to something and it kicks that in. Like, my right leg is not how it used to be, and I look to my left as a model for that, and it's the opposite with my hands, my arms. My left arm is debilitated, but my right is fairly normal. So I look to how they respond to things, and I try to mimic that and create those natural reactions. So, like music, I'm listening to music and I realize that my good foot is tapping, So I try to put that natural momentum I got and reaction I have into my right. And I just try and relax and not really pay attention and just get that right foot going. And, you know, it might still require it does still require a lot of effort compared to the one that's better, but I find it a lot easier to just relax and lose myself and work that out and just keep tapping and build that up. And then I find that the next few days everything's better. And then with that extra grace that I have in my right foot, my right leg, everything, I'm able to do a little more to work out the rest of myself and take myself a little bit further. So it's like those little things. Don't worry with the medication. Like, if you're not having a life-threatening situation, take it easy on yourself, all right? Your body is amazing. And if you believe in yourself, if you carry yourself, you know, nutritionally, you're well balanced, you stay well hydrated. That is super important. Every day I'm giving you the goal that you're going to wake up in the morning, you're going to drink a cup of water, and by the end of the day, you're going to drink enough cups of water that your pee, your urine is clear. Okay? I'm not telling you to go crazy, but just, you want to have that clean urine. That means you got very little toxins in your body. That means you're definitely well hydrated. Everything's okay. And, that's one thing. You start doing the water, then maybe you start taking your multivitamins, or, you go get checked out by your doctor, see what vitamins you're lacking, if a multivitamin's okay, and supplement with this and that. Look into mushrooms as well. You want to put them in your diet as well as supplement. You got lion's mane mushroom is super effective for creating, or sorry, I shouldn't say creating, but it encourages neurogenesis, which is the the um the propagation of new cell growth, new nerve cell growth. So, um blueberries, there's a lot of things you could look it up, at least a few reported, evidentiary things that will increase your 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 communication with your neurons and also help to encourage neurogenesis, which can be very important for people with MS because we're experiencing nerve damage pretty much constantly. To what degree, that is the factor, but that there's a lot of stuff going on with that, and I highly encourage everybody to do their own research. If a doctor recommends something, good, look it up and make your own decision about it. If he prescribed the pills to you, you don't have to take them, okay? I'm not saying don't. There might be situations, and there could be situations that you're in that might require that. And, if you're already on that, I advise that you take that as your doctor suggested and, try and just, you could talk to your doctor about it. and tell him how you really feel and that you want to get off the medication, and see what he tells you. Usually they, it's I say weaning. It's weaning. You get weaned off the medication, and that's where they lower the dosage over time so that your body gets used to not having it, and you can transition to something else that might be working for you, that's not the medication that your doctor prescribed. But anyway, those things are difficult. I recommend you talk to your doctor about those things. I really, you know I can't speak to that stuff other than from my own experience on these matters. So please, if you feel like this might help for you, I definitely advise to do a lot of research, because there's so much information out there. And it's a shame. It's a shame that people, kind of end up hurting themselves in the end with this stuff. And life's difficult enough already, all right? Well, especially people with MS. I mean, it can be terrible. So I just really want to be an inspiration for people who might feel like there's nothing that they can do. I'm telling you that there definitely is, because 2 years ago I really wouldn't have known anything was wrong with me. I've had a lot of, mild symptoms, mild MS symptoms my whole life, but it's like most people could kind of say that, oh, forgetfulness, imbalance sometimes, and shortness of breath, and it's like a lot of these things you're just like, yeah, that's okay. My hand was numb for an hour, something like that. But anyway, there's things that, you know, you just gotta see. I lost myself. So, shortness of memory. Yeah, there you go. But we are late. You know what I mean? That's the thing. I like to. You could find a million reasons to say that all these symptoms that you experience are the disease. Or, you know what? You could be very realistic and say that there's definitely something you can do to stop that from being as bad as it is, at the very least. So you don't need to blame stuff. Don't look for an excuse for these things, because it's you. It's your body. You're the one that's going to suffer in the end. You're going to feel better because you're going to not feel responsible, and oh, I can't do anything about this. But nobody wants to be helpless. And if they feel like they are okay with that, I'm telling you, you're not going to be. All right? Just one little thing. Just one little thing, the hydration, anything, just stretching 20 minutes a day, not even, just to make sure you do it 3 times a day. you know Try to always stretch. Make sure it's for 15 to 30 seconds. When you're holding that stretch, 15 to 30 seconds, that's where you're really gonna, it's like working out. You gotta strain a little bit. You gotta get to that point of creating resistance, and your body going an extra level. It's gotta grow. It's gotta grow. So did that today. About an hour ago. I was dancing. I was dancing for like 15 minutes, baby. Probably looked like a child that just uninhibited, going for it. Lights off, shining. So, I gotta get to bed. I gotta wake up. I got blood work to do in the morning. So gotta check in with everything 10 a.m. So I gotta make sure I get up okay time. And then yeah, another doctor's appointment at 3. And then I got physical therapy at 6. So yeah, stay tuned. Love yous all. Please like, subscribe, follow, shout out anything you guys would like to mention. Please comment, give your thoughts about anything I brought up. Feel free. Appreciate you guys. Thank Take care.